Hello everyone and welcome back to the Welcome to Long-Term Care YouTube channel. My name is Bilquis Ali. I'm an RN and Certified Director of Nursing and Administration in Long-Term Care. If this is your first time tuning into my channel, I want to say thank you and welcome. I hope you find this video and all my other videos educational so that you can improve yourselves and your facilities. Today's topic, I'm going to be talking about medical records and what to do if you have a medical record request from a resident or even a resident representative. Okay, so as always, pull your facility policy first. Okay, and I can't stress that enough. No matter how much information you receive from outside sources that might tell you how to proceed in a situation, always pull your facility policy first, because whatever you do, you need to make sure you are adhering to your policy and that you're actually mimicking it. So if your policy says to do such and such in a certain time frame, then you need to make sure that that is what you're doing. Because as I said, when you have your survey, if they find you out of compliance in any type of way, the first thing they're going to say is, may I have your policy? That is why I always teach everyone to follow your policy first, okay? And then after you gather your policy, then you take the necessary steps. And the information that I provide here are just questions that you can just start asking yourself if you don't see this in your policy. Okay, so for example, if you were to have a medical records request from a resident, does your corporate company need to know about that? Okay, so a lot of times facilities have to go ahead and reach out to their corporate company. Why? Because if there was, say it might have been a complaint, okay, and now the family or and the resident are requesting their records. This gives your corporate company to then pull that record and get whoever, their legal team, that involved to look at those records to get prepared, okay, just to have an idea of what is going on and why might that resident or resident representative want that medical record. The other thing is, some people just want a copy of their record. It's the same as if you were to go to your doctor and, you know, or I might go to my doctor and I say, hey, can I get a copy of my medical records? It's not to say that I have anything going on. It's my information. And I would like to see the things that are going on in my health record. And I like to review everything, okay? There's so many illnesses that pops up in different families, and you might have that information in your medical record. All right, so not everyone requesting a medical record is in a negative, okay? It's not negative. People just like their information, and that's okay. Okay, we like our residents to be proactive anyway and more involved in their care. So again, like I said, always pull your facility policy first. Okay, and remember, it can be oral or written. If your residents say, Bilquis, I would like a request from a medical record. Once they tell me that, I know about it. Okay, so when you're looking at your policy, what does your policy say? Some people say that, oh, they have to sign for it. Okay, once they get it, then they need to sign that they are getting a copy of their medical records, right? Is it a fee involved? Is it a fee involved? Okay, and what are you charging? Okay, and that's the part that you need to be careful about. Okay, if you're charging, you need to make sure you are reviewing that regulation and only charging for what you are allowed to charge for. What is the time frame? Okay, what does your policy say the time frame is for the resident to then receive a copy of their medical records? All right, simple. Somebody's coming to me, Bilquis, I want to have a copy of my medical record. Okay, my policy says I need to have it 24 hours, right? 48 hours, with the exception of the weekend. Okay, all that's in my policy, so that I know that I have a time frame on when I need to have this information back to that resident. What if your policy doesn't have a time frame? Then what? Then what do you do? Do you then call your corporate company and say, hey, this person wants a copy of the medical record, however, it doesn't tell me the allotted time frame that I have to then provide them this information. Your corporate company says, oh, just whenever. Now, since I teach you to look at policy and then regulation, then you go to the regulation. What does the regulation tell you that you need to do? Okay, so this is why I talk about policy, procedure, regulations, and then also networking. Okay, but remember, you always want to start with your policy first. In anything, you're going to start with your policy first. What's the process? Okay, so someone asked for their medical records. How is it brought about? Okay, who is the responsible person for now providing that information to your resident? Okay, more importantly, say your responsible person is off. They're on vacation. What are you supposed to do? I just told you my policy said I need to have that information to them within 24 to 48 hours. And the person who is actually the gatekeeper, the responsible appointed person, is on vacation, or they're out sick, they're on FMLA, anything. Who is your backup person? Okay, so medical records is a very important part of the piece of the puzzle, this department. Okay, like I said, I utilize my medical records for my compliance. Okay, this is an important position. Okay, we're dealing with records, okay, valuable information. So who is your backup person if your resident requests records and your medical records person who handles that is off on vacation or just not available, and they're not going to be available for a week? What do you do? What do you do? Ask yourself this question: what am I supposed to do if my medical records person is off, but I have a request for records? Okay, and you go look at your policy. My policy says 24 to 48 hours, so I better figure it out from my end. Your policy doesn't say anything. You go to the regulation, and it says 24 hours, 48 hours, with this section of weekends. So that's your answer. Okay, so then that means you need to have a plan B in place to cover your medical records department for at least your medical records request. Okay, and then who checks the checker? So who is the person that then makes sure that says, oh, okay, so Mrs. Smith said, you said that he had a medical request, Bob isn't here, he's on vacation. Did you get the medical records to the resident? And I'll say, oh, either yay or nay. So then who's the person that's checking to make sure that the resident request was fulfilled? And then who's the closer to make sure, okay, the medical records, it was sent and, the resident received it. Do you have them signed to say, hey, I received my documents, or is it just word of mouth? Okay, so these are just some of the things, some of the steps that you can take when the resident requests the medical records, all right? Of course, like I said, follow up with your corporate company. They might have a process in place that, hey, anyone requesting medical records, make sure we know about it. This way, we can all have a head start on anything that might need to be further evaluated or investigated. Can this process be covered in your admission process? Okay, and I'm not saying by nursing, but say someone from your admission team, your business office, or anything like that, does this come up in that process and say, hey, when they're signing their financial paperwork, by the way, since you request your medical records, this is a process that we go about. So again, I'm going back to the admission process where a lot of time, and the residents or the resident representative might not remember, but it's a good place to say, hey, if you ever were to need any type of records, this is our process, and this is how you can go about receiving these documents. Okay, it's just letting them know ahead of time, all right? And again, like I said, make sure you're reviewing this policy, make sure you're mimicking your policy. Whatever your policy says to do, then that is what you need to follow, because if anything were to come about you being out of compliance, that's what they will ask you for, is your policy, okay? So that is my tip for today on medical records requests. Again, my name is Bilquis Ali. If you like this video, please like, comment, and subscribe to my YouTube channel so that you can be aware of any time I put information out. Also, visit my website schedule for the survey prep course. This will definitely help you get on the right path. You can also purchase the book, Welcome to Long-Term Care, Book 1 and 2, as well as the planners for both the DONs and NHAs. Okay, that is all I have for today, guys. Have a wonderful day, and I'll talk to you soon.